Site preparation, which applies to all attachment accessories and application sites. Select the appropriate attachment accessory based on the following criteria: patient's age, parameters to be measured, and patient's skin condition. Measurement sites and means of sensor application. For parameters of PCO2 and SpO2, the earlobe, low on the forehead, and cheek are valid measurement sites. For intact skin, the ear clip or MAR-MI can be used. For sensitive or fragile skin, the MAR-SF should be used. For PCO2 only measurements, the earlobe, low on the forehead, cheek, thorax under clavicle, and area behind earlobe on the mastoid process can be used. Once again, for intact skin, the ear clip or MAR-MI can be used. For sensitive or fragile skin, the MAR-SF should be used. Avoid placement over large superficial veins or areas of skin breakdown, and ensure skin at recommended site is intact and in good condition. If necessary, remove excessive hair. Clean site with an alcohol wipe and let it dry. This is necessary in order to remove any oil from the adhesion site. Verify that the SDM is ready for use and verify the settings displayed on the Ready for Use screen. Applying the sensor with ear clip. Open the docking station door of the monitor by pressing on the front of the door latch from above without applying excessive force and take out the sensor. Note, always hold the sensor at the sensor head. Do not pull at the sensor cable. Close the docking station door. Press the sensor into the ear clip until it snaps in. Use a new ear clip for each new patient. Check that the sensor can be easily rotated to assure that it is snapped in correctly. Pull off the liner protecting the adhesive tape of the ear clip. Place one small drop of contact liquid in the middle of the membrane surface. Make sure to keep the ear clip open and to handle the sensor such as the contact liquid does not run off the membrane. Avoid wetting the adhesive pad of the ear clip. Pull the earlobe in a horizontal position. Move in the sensor from the side and attach the sensor from below to the back side of the earlobe. Close the clip from above, then guide the earlobe back into vertical position. The sensor is applied correctly if the whole dark surface is covered by the earlobe. Make sure that the sensor has good contact to the skin, no air gaps between membrane and earlobe. Wrap the sensor cable around the ear once, tape the cable to the cheek, and secure the cable with a clothing clip on the shirt or bed linen. Ear clip removal. The removal of the sensor will be requested by the monitor when the remaining monitoring time has elapsed. To remove the sensor from the patient, grab the ear clip and pinch to release tension. Remove the adhesive tape and the ear clip carefully from the patient's earlobe. Detach the sensor carefully from the ear clip. Applying the multi-site ring. Clean site with an alcohol wipe and let it dry. Remove the cover of the adhesive on the multi-site ring and attach the ring to the measuring site. Press gently on the center snap ring. Move your finger around the ring circumference to ensure a good adhesion of the entire adhesive to the skin. Apply one small drop of contact liquid to the skin area in the center of the attachment ring. Alternatively, you can use a cotton swab to apply the contact liquid. Ensure that the contact liquid does not wet the adhesive ring. Open the docking station door and remove the sensor. Holding the sensor at the cable strain relief, approach the MAR from the flap side and first insert the nose of the sensor into the ring. Then apply a slight downward pressure on the cable strain relief. The spring tension of the application device will pull the sensor into place with little to no pressure on the skin. Tape the cable at a distance of 5 to 10 centimeters from the sensor head to the skin. Finally, secure it with a clothing clip on patient gown or bed linen. Sensor removal with multi-site attachment rings. It is important to note that the multi-site ring can be removed or left in place for reattachment. For reattachment, place a finger on either side of the sensor. Rotate the sensor towards the index finger. The index finger will act as a wedge and will disengage the sensor from the ring. Inspect the site for any irregularities, and if reapplying the sensor, make sure to reapply patient gel or water to the application. If no reattachment of the sensor at the same measurement site is necessary, remove the multi-site attachment ring from the patient's skin. Additionally, PCO2 only measurements can be taken low on the forehead, the cheek, and the skin area behind the earlobe.